The content herein is for informational purposes only, not intended as medical advice, diagnosis, or treatment, and is not to be substituted for direct advice from your doctor.
Welcome to Lymphcast, the gathering place for physicians, healthcare experts, and special guests. We dive into the world of lymphedema, venous disease, and other related disorders, exploring their impact on your daily life. So settle in, unwind, and join us as we uncover everything you need to know about lymphedema and related conditions on our engaging show Lymphcast.
Today's Lymphcast program is proudly sponsored by Vita Support MD, the makers of Vein Formula 1000 and Lymphatic Formula 1000. These MPFF-based nutraceuticals are backed by science and recommended by doctors specializing in venous and lymphatic disorders. Visit vitasupportmd.com to learn more.
Well, greetings and welcome to our Lymphcast show, episode 39 today. Very glad that you are with us. We have a heavy content and a terrific show planned for you. Before we bring the panel in, let's make a couple of announcements. First of all, we want you to visit our website early and often, and that website is lymphcastnetwork.com. And if you have a message for somebody on the panel, please send in an email, hello@lymphcastnetwork.com. And also, this show is on YouTube, and it's on just about every podcast platform out there. Just type in Lymphcast or Lymphcast Network, and this show will come up. Let's go ahead and meet our panel from Arizona, Dr. Monica Glavitsky. Hello, Monica. How are you today?
Hello, everybody. Nice to be with you again. And I'm looking forward to hear the story of our invited guests.
All right, very good. From California, Dr. Emily Eicher. Hello, Emily. How are you today?
Hello, everybody. How wonderful team, and welcome our beautiful ladies who will give us an update about your lymphedema.
All right. From New York and RVT, Jacqueline Sasek. Hello, Jacqueline. How are you?
Hi, Paul. I'm well. How are you?
Excellent. The creator and founder of this show, also the creator and founder of Vita Support MD. They make Vein Formula 1000 and Lymphatic Formula 1000. Again, from New Jersey, physician, surgeon, Dr. John A. Chubak. Hello, John. How are you?
Hi, Paul. Doing fine. Good to see you. Thanks.
You too. And I'm going to turn it right back to you, Dr. Chubak. If you want to bring in our two guests, we will kick tonight's show off.
Sure. Tonight's guests are very special to me because they happen to be my patients, two of my patients. So I think this may be the first time that we've had one of my own patients on the show. Certainly the first time we've had two who are sisters. And we have Alisa Jarski and Stephanie DiGiacopo, both of whom are from New Jersey, living here in New Jersey. And their story is very interesting. I'll tell a little bit of it as an introduction, and then I'm sure they're going to get much more in detail as we have our discussion today. These two sisters are interesting because they have a father who was a surgeon to begin with. And it turns out that their father also, although perhaps in some denial now at the ripe old age, God bless him, of 95, seems also to have had lymphedema, although he doesn't necessarily recognize that. But these two sisters, their story begins when Stephanie, as a young woman around 20 years of age, noticed that her feet were looking swollen and had kind of a muffin-type appearance that made her very self-conscious. And her father, being a good father, brought her to New York City, to see a specialist who gave her sort of a loose diagnosis of lymphedema at that time, which was almost 40 years ago, which he should be commended, or she should be commended for making that diagnosis even loosely at that time. And unfortunately, Stephanie was told there wasn't much to do in terms of this process progressing. And this sort of went on like this for some period of time. And then later, Alisa also recognized that she was having the same kind of changes in her feet and in her legs, and called Stephanie, obviously very concerned and upset, and said, I think I have what you have. So that went on for many, many years, and it was really troublesome to both of these ladies who are otherwise very active and successful and fit and slim and so on and so forth, that they were dealing with these swollen feet and ankles and legs. And some time ago, in the last year or so, I had the good fortune, 1 to 2 years, in meeting both of these ladies, and made the diagnosis of phlebo lymphedema, probably secondary lymphedema on top of primary lymphedema. And we went ahead and treated both of them. And I think it's fair to say that they both have had really very excellent results. I'll leave that to them to say. But I think that they were also very, very pleased to know that there, in their case at least, there was something other than compression stockings and lymphatic pump, et cetera. And of course, we treated them also with dietary supplementation, as well as all of the compression therapy, but we also did some interventions on their veins. And I think they're both doing much, much better and are much happier. So Alisa, Stephanie, welcome to the program, and thank you for joining us.
Thank you. We're so honored to be here, honestly. Yeah.
And we're honored to have you. And I have to say, if for no other reason, these ladies, we should all know, we now know who's been watching our show. It's these two. They watch the episodes over and over again. And when their kids or friends or family members get in their car, it's like me with personal development. They say, not the Lymphcast again. they love the Lymphcast. And so thank you for that. So I guess I would begin by just opening the floor to the two of you. I gave kind of a very brief synopsis and a very superficial synopsis of your background. Why don't the two of you just, in your own words and in your own way, tell the audience and tell us and our panelists a little bit about that story I told in your own words, please.
Right. So I'm Stephanie, the older sister. I just, as far back as I can remember, I was so embarrassed about my feet as a little kid. They always looked like little puffy muffins, and I'd look at other people's feet and notice that mine really had no bones. My toes are short. They were just so fat always. And then as I started to get into my teenage years, and I got more swelling, I could see that I could stick my fingers into my feet or my ankles, and it would leave pitting. And it kind of came and went, but never went away for long. The swelling kind of came back more and more over the years. And when I was around 20, my brother was graduating from Boston University. And I remember we went to his graduation on a hot June day in Boston. And the event was out on a football field. And my feet were, I want to say, the size of my head. They were insanely large. And I was so panicked and embarrassed. And my boyfriend at the time, who is now my husband, he was trying to carry me, we just couldn't wrap our heads around what was going on. So then it was shortly after that my dad found a specialist in New York, and I believe he was a vascular specialist, but I'm not exactly sure. But I remember sitting in the waiting room, and people that had very serious advanced stages of lymphedema and really large limbs. And I just thought, oh, wow, is this where I'm going? And that doctor gave me something that was sort of almost looked like a bandage, like a knee-high bandage with a little hand pump that you can sort of pump up. But he really said that it's chronic. There's nothing you can do about it. And that was it. So no compression or this is what you should do or not do. It was kind of there's nothing you can do. And that was it for the start of it for me. How about you, Ali?
Okay. So I'm Alisa. And so I came to it maybe a little bit later than Steph did, but I remember most vividly at the end of my college years when I was getting a job. I remember, wearing heels to work, and all of a sudden my feet would get very swollen and uncomfortable by the end of the day. And I think when I really came to the realization, I was at grad school, and I was just trying to wrap my ankles in ace bandages because something was wrong. I had swelling. And then I remember when I was going out on a date and I had my foot in a bucket of ice water to try to bring the swelling down. It was like trying anything to, just what was going on? Why are my feet like this? And it was just a horrible realization to come to. And I remember I called her and I just was crying and I said, I think I have what you have, and it was this sort of, and, then my dad also took me to a doctor and it was a similar, we're only 2 years apart. So it was a very similar reaction to that. I don't even think I had any imaging done, maybe some ultrasound or something, but it was basically like, we think this is what you have. It's a chronic condition and,
progressive.
I really don't even think they gave me much advice on to do anything really. So we were kind of left in a very, we didn't know what to do. It was like, okay, we have to deal with this. And that's how it went for years and years and years.
So how did you switch from this situation, no help, nothing to do with, or no? How could you get to the point of doing something, or the finding help, finding the methods of treatment?
I would say for many years we did nothing other than be really horrified anytime we had to go anywhere in the summer months and, have our blowing up. And we had no doctor ever that said, oh, you should go see a special. I mean, there were no specialists as far as I knew. There was no internet. Again, this was like in the 80s. It wasn't really until I went to a vascular surgeon at one point to try to get compression stockings because I had read somewhere that you should be wearing compression stockings. And he did give
Hallelujah.
He did give me a prescription, but I was already, well into my 30s at this point. He did give me a prescription. He did an ultrasound and said, yeah, you have faulty valves in your lymph system, or you don't have enough lymph nodes to, take care of the swelling. But I do, and he was so nice, and I think he meant this in a very good way, but I remember him saying, you have beautiful legs. You should be happy, learn to love what you have, and it could be so much worse. And I know that sounds positive in a way, but I just thought, okay, so there's nothing I can do again. And I had started getting a pretty bad varicose vein by that point. And he said again and again, don't even consider doing anything about it. You're lucky for what you have. It could be so much worse. I think from there, I don't know. Do you want to jump in? I
mean, it's sad to say that we went so long without doing anything, but that's how it was. We had no resources. So I would have to say what really kickstarted it is when the internet came about and we could start doing our own research. So we started, we would be on the phone together, Googling the same things, trying to find out, anything, find a doctor. We would put in, lymphedema doctor and just nothing came up. And then we found this place in New York City. And this is really only going back now about 6-7 years. Yeah, so, we're pretty recent to actually trying to really fundamentally change what we were doing, which was essentially nothing. So we went to this place in New York City and they really kind of helped us say, you can do something, get the compression stockings. And it really kind of got us on a path of like, let's put our heads together and try to figure out how we can make this better for us.
They were also, I would say, the first people, and I have to say the man's name was Michael L. Triest, I think his name was, so understanding of our condition, compassionate, and I think possibly because there was this really beautiful young woman who worked in the office who had pretty advanced lymphedema in one leg. And she was so cute. And she'd say, look, I just double up my compression and I wear these long skirts. And it was really the first time connecting with someone. I mean, I didn't know other people that had it and how they dealt with it. I have to back up for 1 second, though, for all those years where we really had nothing, where I would say between like 20 and 35, I used to just every day I would get home from work and I'm a teacher, so I stand all day. I would lie on the floor, not just on my couch with a little elevation. I would lie on the floor and put my feet straight up. And then I would try to like massage all the fluid out of my leg. And I didn't know about MLD. I know I probably damaged my lymph nodes. I don't know, because I would literally just try to squeeze the fluid out of my leg.
No, certainly not. No, you didn't damage. Quite the contrary. I think that was somehow you found it.
At some point,
that was a very good intrinsic, innate instinct that you had to do that. Your body was telling you the right thing to do.
Yeah. I also started at one point, my primary care doctor gave me water pills, and I always was a little afraid of taking anything. And I knew that was not a cure, just intuitively. But he said, yeah, you could take these when it's warm in the summer months every day, and if it helps. And I didn't want to do that, but I did take it like if I had a wedding coming up and I wanted to wear a dress and heels, I would take them for like the week before, and kind of worked a little bit in the sense that I could go to this wedding, and in the first hour, maybe at the cocktail hour, people would say, "You look great. Look at your feet. Look great. You look, really wonderful." But the minute I had a drink and an hors d'oeuvre, it was all over, and they were back to just huge. And then the more I did it, the more I realized, and I didn't put 2 and 2 together until I heard it on Lymphcast. I can't remember who mentioned it, but about a rebound effect, and how when you're, sort of pulling all the water out of your system, the proteins sit there and can't get out easily. So I did that for a good 5 or 6 years. And before I really realized that was really just ridiculous. I mean, I also think part of the reason we were when I say complacent, it wasn't, but because my dad, not only did my dad have it, but his 3 sisters had it. So we grew up, and his mother had it. So we grew up seeing this, and they never did anything about it. So it was almost like we just not getting any professional advice, and then not seeing any of them doing anything about it. We just figured, okay, this is what we have to live with. So I think that's why we had this, period of not really knowing where to turn, although we always knew like this, we can't live like this. And I mean, I think when, Steph is talking about the wedding, I think what's so hard about it is it's like, yeah, we're active, we eat well, we exercise, but it doesn't matter. Like all that you do for it, it occupies our every waking, well, not every waking moment, but it occupies a good portion of our everyday. Oh, my foot's starting to swell. Oh, I can't have a drink. Oh, that'll make it bad. I want some tortilla chips and salsa. Oh, it's going to make my feet swell. So it's just a constant psychological problem. I mean, it really is. It gets you down. And honestly, if I didn't have her to talk to about it, I would be in a very much darker place. It's horribly.
Yes, I can really imagine what it does. But to tell you, I was in a absolutely exceptional situation, because in the years 90s, so a little bit at the time that you are talking about. So I was starting working on the development of drugs for venous and lymphatic insufficiency. And so I visited all the centers in Europe, knew everybody, and was very close to Professor Picard. Professor Picard was a radiologist who was one of the very first one who performed the lymphoangiography, who was really like a specialist in lymphatic system. And he always was, when we were discussing the treatment, he always says, what do you want to do? You cannot do anything. This intervention doesn't work. This doesn't work. This doesn't work. And in one moment, I went to visit the Foldi clinic. Professor Foldi, who was a Hungarian, established a beautiful clinic in Germany. And I went there. I spent several days. I have seen their method. They like looking at their patients, what they were doing, and it was like eye-opening. I know that it's limited, that, nothing is perfect in this world, but they had like the huge results with the available compression therapy, the lymphatic drainage, the intervention when by Baumeister, when it was possible. And you have seen these photographs before and after treatment, and you have seen really terrible, terrible cases. And they are almost, they were almost able to normalize the appearance of these extremities. Yeah. And I'm coming back to my wonderful friend, Professor Picard, and saying, Jean-Daniel, look at it. I have the documentation. I visited them. I examined what they are doing. It works. No, that's not. I don't know, it's kind of resistance, like it was, you almost felt the resistance of the medical world to accept that lymphatics are important. Yeah. And you felt that resistance to accept that these are valuable treatments.
Right. Vein Formula 1000 and Lymphatic Formula 1000 from Vita Support MD are backed by science and sold in doctor's offices. If you're a physician who may be interested in prescribing or selling these excellent nutraceuticals, please call 862-246-7877 to speak to a representative today.
Well, before we were lucky enough to find Dr. Chubak, I had made a few calls, because I think we got to the point where we said, all right, we're going to do something. And I was trying to find, I've had a whole problem with my insurance. It's ridiculous what I've gone through to try to get them to pay for compression stockings. And as it is, I'm paying all for it out of pocket because it's so much trouble what they're expecting me to do to get pre-certification and, go into New York City and get measured there. And then, I got approved for one place and they said, oh, you have to, we can't work with you. They're approving too little of reimbursement. I mean, it's just been ridiculous. But so I wanted to find a doctor to get a prescription for compression stockings. And I called a few places and it was almost like, oh, no, we don't see lymphedema patients. Or we even got sometimes, we only deal with secondary lymphedema. We don't deal with the lower, primary or lower limb, so it's a struggle all around. And this is recent, so.
Stephanie, I can, or both of you girls, I can write you the prescription. I'm here in Santa Monica, and I have very similar story, unfortunately, with me. I had lymphoma, and 10 years later, after medical school, and in the midst of my surgical residency, I developed lymphedema. So going back to your onset of swelling, I have a question, Lisa. You started with swelling of both feet, both one more than the other?
Definitely one more than the other. And that continues to today. I mean, started in your before teenage years. I was a little later when I became aware of it. That's not to say that it couldn't have started, but it really started affecting me when I was in graduate school. I just became very aware of it. So that was in my, mid-20s.
Right. So for our audience, I'd like to say you are describing what we say congenital or primary lymphedema. And if you start before the age of 35, it's precox. If you start later, then it's tarda. That means later, okay? But it's congenital malformation or absence of the lymph structures, usually in the groin area. And lymphedema is always unilateral, or if bilateral, one more than the other. Right. Secondary lymphedema is when you have some other incident, cancer, surgery, radiation treatments, trauma, infections, and so on. And it's the same. Usually one leg is more involved than the other, or just one leg. So now I have a question. Did you have, so similar to you, I was dipping my leg in the cold and hot and trying all kinds of compression stockings, which drove me crazy and so on. Eventually, I stumbled upon a French therapist who knew Professor Leduc, one of the fathers of European lymphology, and he introduced me. He came to the United States, gave a course, and finally I said, somebody knows what they are talking about. He was describing my lymphedema, similar to yours. You know, the shoe doesn't fit, the ankle is swollen, and so on, so on. And so I became the member of the society, Lymphological Society. And true, in Europe, we had more advanced approach or education on lymphatic system than here. And Monica knows, Dr. Glovitsky knows, 20-something years ago, I presented at the American College of Phlebology, I believe it was phlebology, and something about lymphatic system. And I was so happy because the classroom was quite full, and during my talk, little by little, all the vascular surgeons were disappearing, and I went like, oh my God, I took a shower. I do have an accent, but it wasn't so terribly bad, and I didn't know, nobody was interested. Nobody was interested in lymphatic system. Unlike today,
right.
Scientists like Dr. Monica and surgeons like Dr. John Chubak and internet. Now, a little bit more about lymphatic system, but it's still downplayed, ignored, misdiagnosed, and so on, so on. So my question is, did you have lymphoscintigraphy?
No, I don't think we ever had any testing.
So, is the next flight to Santa Monica?
We'd love
to visualize what is going on with your lymphatic system. And the gold standard is they see a lymphoscintigraphy, which will show us the anatomy and also the rate of flow. And then today we have more advanced techniques to see how damaged or absent your lymphatic system is, because it will give us the picture of how much you're going to improve and so on. But it seems like overall you did fabulously well. And the key is you are slim. If you would be much larger, the swelling, as you know, will progress. And it will be much more symptomatic than it is now. And also way back when I went to one of the PMNR meetings, and this wonderful, young, beautiful, brilliant physician says, oh, lymphedema is a painless condition. So after that, I went and I talked with her and says, painless, I don't have it, because as you said, yes, we have symptoms, and it is a time-consuming, luxurious a condition where you have to address it on daily basis.
Absolutely.
Whether it's just compression, self-massage, doing some compression, and wearing compression stockings, and be careful not to have a cuts, open lesion so you don't get infection, and diet and supplements. Now, thanks.
It is. It's a full-time job. So I find sometimes I leave for work in the morning and I feel pretty good in these shoes. And then by the time I walk out at the end of the day, my feet are so swollen. And sometimes I've even, if I found a pair of shoes I love, I'll buy them in 2 sizes because in the morning they fit great. In the afternoon, I need a bigger size. I mean, it's absurd and it's depressing. And it's, I don't think an hour of my entire life has gone by that I haven't been aware of it.
oh, put your foot up on that, or oh, don't sit over there, it's hot, or don't. It just everything.
Or you get an invitation to a wedding, and the first thought is, oh my gosh, what am I going to wear? Maybe I can go late. Maybe, I mean, it really, it's everything. Oh, the summer's coming. People get all excited, right? Our first thing is, oh, it's spring. It's going to be sandals. I mean,
Yeah, it's easy to wear the compression in the winter. Like in the winter, I am 100% morning till night every day. I don't even think twice. It's easy, but I don't know. In the summer, it's wow, what a challenge. And then I think, wow, we work so hard to eat right, to be happy, active people, and can't our skin ever see the sunlight? Like, so then I always try to dabble with, all right, I'll try going out for a couple hours and do all my errands and just wear my sandals. And, and then I have to come back and put my feet up. And it's a constant, it's
preoccupation.
A lot.
Let's talk about, because I think it's an important part of this particular story and their clinical situation that may give other patients out there hope, how you came to find me, and then how your experience was working through my center, and after the vein diagnosis and treatment, and how everything has been from there on versus up until that point.
Right. Well, I'll start. Well, first of all, we're always singing your praises, and honestly, you have been such a hope for us, because I mean, right before I came to you, I was calling and asking people, and lymphedema, we don't see those patients. When I found you and I called, and everyone was so nice. Yes, come in. Yes, we see lymphedema patients. It was like I was so excited. And I remember coming in, and you were just so. You gave me so much hope, because you said, yeah, I think we can do something to make this better, and diagnosed us with with the phlebo lymphedema, which I had never even heard of that word before. So we didn't even know that was anything to be, concerned with. And just the fact that everyone in the past have been, oh, don't touch anything, don't disturb it, don't. Be careful cutting your toenails. Don't when you shave, don't nick yourself. Yeah. I mean, so to hear you say, I think we're going to treat this, and I believe it's going to make you better. It was just, I walked out of there and I called her crying. I was like, this is just so awesome that
I think also after you met with Dr. Chubak, I still had this varicose vein that in my mind, I kind of knew that my lymphedema was it seemed to be getting in the past maybe 5 years. So I just turned 60. And in the past 5 years, I would say it's gotten much harder for me to manage. Like anything I used to do that used to give me some relief, like putting my feet up, being super strict with my diet, like anything I could do, I could kind of keep things at a certain point. But then it had started getting harder and harder to do that. And in fact, the last time prior to going to see you, was going to a wedding. It was after COVID. I was so excited. I couldn't wait to get out there. And I had taken a few water pills the week before, and my feet did get, they didn't get small the way they used to at all. And I kind of thought, I'm past the point where these water pills even work. And I also had developed a varicose vein on the one leg. And Alisa, one of the things she said was, you have to go to him and show him the varicose vein. Maybe that's what's making things worse. And so when I went to you the first time, same thing. I came home and my husband said, how did that go? How was Dr. Chubak? And I couldn't even talk. I still find it like, so it was literally the first time in my life that anyone said, I think I can help you. And he was very clear. He said, I can't give you 100% guarantee, but I really believe that I can help your swelling by treating your veins. And that is just a whole new world. Yeah. And honestly, the treatment, the first time for me, I think my lymphedema is worse. I think my veins are a little worse than hers, but
well, you're older.
Yeah. A little bigger. But anyway, I do remember the first series of sessions. I thought, oh, wow, this is a lot. I have to actually back up for a second, too. Before we did the first treatment on me, a doctor had said to me, you really shouldn't do that. Doesn't sound like a good idea to touch your veins. Please go get a second opinion before you do anything. And I did go to another vascular doctor who did an ultrasound and said, yes, I agree with everything Dr. Chubak is going to do, but I could do it for you in one day, one session. And I can't describe how thankful and how blessed I feel that your approach to treating us and treating people like us is to go slow and to work in pieces and to be so careful and so cautious and so conservative every step of the way. So yeah, it felt like a lot before I went through all those treatments with you, but it's not that bad.
And it's made a tremendous difference. We really tremendous. Like it's been so, yeah, I have to say it's the only thing that has helped us. And, it has inspired us. I mean, we always were pretty good recently with the compression stockings, but now it's like we put them on all the time. We're taking the supplements. It's really, it's been life-changing, honestly.
Yeah. And I'll say too, from just thinking about how I sort of have alluded a few times, like, yeah, your feet are okay in the morning. And then by night, they're a whole different foot. They're swollen and uncomfortable. But since getting the treatments with Dr. Chubak, I think I told him this once, but when I have my coffee in the morning, I put my feet up and I can't stop staring at them. Like I never cover them with a slipper even. I just want to look at my feet because they're actually bony in the morning. And even if I did everything wrong that day, I went to an outdoor picnic, I had wine, I had chips, I had whatever, and my feet get kind of bad by the nighttime, they are perfect by the next morning again, that is a completely different thing. It used to be like if you ever let your feet get to being very swollen, it would take like a week before, if you're lucky, they came back down. And
What was the intervention?
Well, they had venous insufficiency in the truncal system, in the saphenous veins, and some varicose veins, and really significant venous insufficiency. But, I want to just touch on a few points for physicians listening and specialists in this area and patients as well. I think everything that has been said has been true. Certainly, I think that these ladies began with lymphedema precox, a congenital primary lymphedema at an early age, probably starting just after puberty, quite frankly, but when they got a little bit older and more mature, they started to notice it, especially social situations and dating and things, and it became more evident to them that there was a problem. So certainly I think they had primary lymphedema, which has been congenital and familial in their case. They obviously have a very strong family history. And then when they came to see me, they really saw me at the right stage of my career as well, as a very experienced vascular surgeon and vein specialist. Had they seen me 20 years before, at the very beginning part of my career, I probably would have done what a lot of physicians and vascular surgeons that they had seen in the past did, which was to say, I don't think we should touch anything, because I would have been fearful to make things worse. But after 20 years of experience and lots of training and lots of study and lots of discussions and taking care of thousands and thousands of patients now, I learned that we can help patients like these who have secondary phlebo lymphedema superimposed on primary lymphedema, congenital lymphedema. And I can remember meeting them both. And you can imagine, I try to spend a lot of time with all of my patients and educate and discuss. But in the, certain circumstances are more difficult from the physician's point of view than others. When you have two sisters, number one, right, who their father is a surgeon, number 2, who are highly educated, both of them in their own rights, number 3, and who are lovely looking, very fit people that many people would meet these ladies and look at their legs and look at their feet and say, which they did say to them, you're really lucky. I mean, this is really not bad. I mean, we see much worse cases. So as the surgeon, you're saying in the back of your mind, the inclination is to say, run away from this. You don't need this problem. Two beautiful, educated ladies who their father is a surgeon. They've seen all these doctors in New York City. Everybody said, don't do anything, don't touch it, leave it alone. And you're thinking the last thing in the world that I want to do is make things worse. That's, Hippocratic oath, do no harm. The last thing you want to do is make things worse. And as I said, if you had come 15 years before, I probably would not have done anything other than prescribe all of the conservative measures, but I would have been very hesitant to do an intervention. And so after many years in treating patients like yourselves, I've never made anybody worse, thank God, and we've always made people better. But we had long discussion that this was a real possibility of getting worse. Mm-hmm. I hadn't had it happen in my practice. I hadn't had it happen in my experience. But theoretically, because of all of those concerns that people talk about, further damage to the lymphatic system, injury to the skin, inflammation, etc., there was that chance. And of course, it was the last thing that I wanted to do. But the most important thing I wanted to do as a physician and a surgeon was to make things better. And I wasn't going to let fear or risk to myself stand in the way of helping these lovely ladies. So we went ahead. And as Stephanie said, it has been my practice in general to be safe, cautious, and so forth. But in these kinds of cases, definitely to take things in a piecemeal fashion. Dr. Glavitsky knows there's a very interesting case that I'm quite proud of, a woman who had a significant problem with her arm, something called Klippel-Trenaunay syndrome, and actually even a little bit more complicated version of that problem. Is not purely a vein problem, but also had a arteriovenous malformation issue. And I consulted with her husband, Peter, who's obviously a world-renowned and highly, highly experienced vascular surgeon who was at the Mayo Clinic for years. And one of the things that we agreed upon when I took on that case surgically, because this woman had been turned down in a couple of different centers in New York and also in Israel, in Tel Aviv, and was told there was nothing to do for her arm. And it was significantly disfigured, but most importantly, had become very, very painful and could no longer tolerate compression. And it was a surgical procedure that certainly I could have done in one procedure. You just keep going. I mean, it's easy. I'm a guy, I did open heart surgery. I do 8-hour, 10-hour surgeries. You just keep going. But we did that procedure probably in about, I think, 4 to 5 individual sessions, checking afterward, how is the body responding? How is the physiology and anatomy responding? Is she getting better? Is she getting worse? Is she the same? And I had an old professor, Dr. Goldfarb, who was a brilliant man, and he used to say, that's the most important question in all of medicine, better, worse, or the same. When you go to see the patient on morning rounds, are you better? Are you worse? The same? You feel better? Worse? The same? And that's exactly what I was doing in your cases. Do a procedure, first stage, and see, are we better, worse, or the same? And as long as we're not getting worse, that's the big indicator, then we can carefully and slowly and gently move forward. And we did that very successfully. So I'm very, very happy with the results. And of course, we had a discussion at the beginning that this is secondary lymphedema superimposed on primary lymphedema, so that we never had the expectation for perfection, that the edema would be completely resolved or the condition would be completely resolved, because we weren't doing anything in terms of anatomical surgical treatment of whatever lymphatic insufficiency there is. It was only to unload the lymphatic system from excessive edema that was being caused by the venous insufficiency and the venous hypertension. And I think we had a wonderful result that I'm very, very happy with. And I'm so happy for the two of you. And I'm very proud of the result. And that's why we're having the show, to share these experiences, my experience as a surgeon and as a specialist and a clinician, and Dr. Eicher's experience as a PM&R physician, and the patient's experience. And recently we had Dr. Borson on the show from Sweden, and it was eye-opening for me, the liposuction treatment he's doing. We had a wonderful surgeon from Mayo Clinic doing lymphovenous anastomosis. And I think we're at a very, very important philosophical, clinical crossroads where many patients with different stages, different causes, what we call etiologies, reasons for their lymphedema, are going to be more and more frequently now candidates for some form or multiple forms of surgical intervention or intervention, non-surgical and surgical, injection, laser, microphlebectomy, lymphovenous anastomosis, lymph node transfer, liposuction. And this is really a new dawn for vascular surgery, vascular medicine, and just the concept of the inclusion of the lymphatic system into the circulatory system is a major step forward. Yeah. I hate to say that. But now, having over the last, let's say, 50 or 100 years, really come from complete darkness and ignorance, slowly but surely unto compression, hands-on therapy, non-surgical means of drainage, better and better diagnostic tools with lymphoscintigraphy, which again, in your case, we discussed this a lot on the show. I didn't think was necessary. I didn't think it was going to add anything to your surgical treatment, at least. Ultrasonography, which Jacqueline is an expert in venous ultrasonography. For many years, she ran my lab. I just think I get almost emotional thinking about it. I just think we're at such a watershed moment in medicine, in a field that's going to affect tens of millions of people, at least just in the United States. Forget about what we're seeing around the world. So I think that the surgical aspect may be the most exciting new thing that's happened in decades, knowing that we have these different tools and now we have to get surgeons trained up properly and educated and to know how to properly diagnose each and every patient and how to apply these surgical tools, because the surgical tools are going to be some of the things that give patients a more enduring or lasting result, as opposed to just getting back in the stockings every day, just wrapping again every day, just MLD every day, just MPFF dietary supplementation every day. One of the things that's so appealing to surgeons about surgery is that we have the feeling in many cases that we can, quote unquote, fix things, not just put a Band-Aid on things. So I certainly don't have all the answers, which is why we continue to have the show. When we have all the answers published, we can stop the show. But we certainly have...
Not at all, because those answers to be heard by a large audience need to be repeated. So even if we have several answers and growing knowledge, I think we have still a huge ignorance by a lot of physicians and a lot of patients, of course.
Right, correct. Which is why this really explains why this has been a labor of love, and we've really hung on to the show and continued to produce the show and make the program to educate physicians and clinicians of all kinds, nurses, nurse practitioners, physician assistants, therapists, vascular technologists, podiatrists, on and on and on, and of course the public and the patients. For someone to be able to listen to a program or watch our program and point and say, oh, that's me, that's what I look like, that's how I look, that's how I feel. And one of the other things I wanted to bring out, this is so obvious in today's program, which is why I wanted Alisa and Stephanie to be on the show so badly. And they're naturals. I mean, they're incredible on the program, but you'd be surprised how shy they are and camera shy. It took some convincing, but they're like stars. They should have been movie stars. But the thing is, the psychosocial and emotional aspect of this disease that we've talked about again and again and again, and that this is a multimodality treatment and it should include everyone you can possibly think of: a vascular surgeon, a general surgeon, a plastic surgeon, a physical, medical, and rehabilitation physician, physical therapist, certified lymphatic therapist, vascular technologist, nutritionists, dietitians, psychologists. This is really a disease process that any page of the the medical specialty book that you open, it seems someone should be involved. And we need to educate everybody that we all have a hand in this. Not one person can fix this. And it's so complex. But the last thing I want to say about the psychosocial and emotional part of it is, when you look at two lovely sisters like this, beautiful, fit, educated, intelligent, slim, and believe me when I tell you, as a vascular surgeon dealing with this each and every day, we see, and we've all seen, they saw, even when they went to visit some of these vascular specialists in New York many years ago, we've seen the significantly disfigured limbs. And everyone's heart goes out to those people who have one or two, for lack of a better word, extremely disfigured lower extremity, upper extremity, or both. But the psychosocial and emotional aspect that we know those patients suffer from is not limited only to these sort of extreme cases.
Absolutely.
Yeah.
People who have mild to moderate disease are really suffering from this, not just physically, pressure, pain, and so forth, psychologically and emotionally. And they should not be dismissed because their disease in someone else's eyes are mild. Their signs and symptoms are mild in the eyes of the clinician, the physician, the surgeon. They should not be dismissed. And this is a word that I use so much on this show, that in this disease, this compendium of diseases, lymphedema, lipedema, chronic venous insufficiency, etc., there's just far too much dismissal of patients and their complaints and their concerns. And it's negligence.
But it's once again is the question of the ignorance, because this is a progressive disease. I'm sure from what you are saying that if you would not pay attention, not limit your diet, not exercise, not do anything, you would be that disfigure people.
Yeah.
It's not coming like only for those the people who had a bad chance to have the bad form of the disease. This is the question of progression and what you do. And I used to, discuss a lot about the venous ulcer, for example, and we discuss a lot in the French circle of phlebologists, and everybody almost unanimously agreed. Whoever is exercising, really, and taking care of the venous system, will not have the ulcer, because even you have the disease, of course, you have the sometimes really a severe disease, but if you do something, if you try to follow the good rules, you avoid this terrible ultimate stages.
At VitaSupport MD, we believe in creating the best bioflavonoid-based supplements to support your vitality. Bioflavonoids are found in abundance in nature and support excellent health and wellness. The demands and stresses being put on our bodies in these challenging times are unlike any we have seen before. Support your body with the flavonoids it needs to fight inflammation and oxidation. Unlike other products in the marketplace, VitaSupport MD dietary supplements use micronized flavonoids for optimal absorption and effectiveness. Micronization is an advanced process which creates an ultra-fine powder easily absorbed by the body. At Vita Support MD, we are passionate about making your good health our life's work.
Yeah, and I think that's a great point, Monica. I think that Dr. Glavitsky raises a great point. We've talked about this again, but I think repetition is the mother of education. We cannot say these things frequently enough or over and over enough. In that team of clinical specialists that I mentioned, the most important member of the team is the patient from 2 points of view. Yeah. One, in terms of being an advocate for their own care and never giving up. I say it again and again. I don't care who you are. I don't care what stage of disease you are. I don't care what combination of disease processes you have. There is always hope. Someone can make you better. Some team of people can make you better. But like so many things in medicine, as Monica points out, with venous insufficiency and venous leg ulcer, or there's 1,000 examples, obesity and heart disease, diabetes, blood sugar, smoking, vaping, a million things that we could say. The patient has to be central to that process, so they have to advocate for their own care. If they're not getting the answers they're looking for, don't take a first opinion, a second opinion. Get 10 opinions until you find someone who says, I think I can help you. And then you have to be willing to help yourself. If they say you have to wear this compression stocking, then you have to wear it. If they say you have to use this lymphatic pump, then wear it. If you have to come every other day for manual lymphatic disease or drainage, then do so. Avoid salt, do so. Avoid excessive sugar, do so. Exercise, walk, swim, do so. If the patient is what we call in medicine non-compliant, if they don't, you could assemble the greatest team of experts. If the patient doesn't participate in that process, then you're going to have a failed treatment.
And in your story, you have absolutely beautiful situation, because obviously you are two wonderful, loving each other sisters. That is like the beautiful gift that you have from God, because
yes, definitely. We realize we are very lucky with that.
That's our glue that kept us together.
They're almost like identical twins, right?
It
almost has the same feeling, the same connection. But I want to say one other thing about that, actually, Monica, you reminded me. It is so fortunate that you have each other and that you both are, quote unquote, afflicted with this problem. Because I have seen many times in my practice a situation where the patient, and Jackie knows because Jackie was with me so many years, the patients really feel isolated, really feel alone when they say, why did this happen to me? I'm the only person in my entire family who has this. I have 3 sisters. Their legs are perfect. My mother had the most beautiful legs. She looked like Greta Garbo. My grandmother at 90, right, Jackie?
Yes, absolutely. Right? No.
So you had it in the family. You almost, not just each other, but your mother, your father, your aunts, whoever. You feel like, okay, well, this isn't kind of a cross that I'm bearing all by myself in this world. But we have patients that they're the only one. And then there can be all other kinds of dynamics that come into the picture of jealousy, animosity, feeling inferior, feeling, again, dismissed by the rest of the family. Oh, what are you complaining about? It's not a big deal. You look fine. So I'm looking at Emily's face because she's been dealing with patients with your problems for many, many years. And I'm sure all of these dynamics and all of these situations she's seen many times before. Right, Emily?
Absolutely. We can identify, other than yours is primary, mine is secondary. But I keep saying it's a gift. We have to pay attention to ourselves, to our body, and be compliant. And then you do well. Yeah. But if you would gain 50 pounds, your leg is going to be much bigger. Yeah. And so we have to, as the doctor told you years ago, embrace what you have and protect.
I was going to say two things that I think are so important that you brought up a minute ago, Dr. Chubak brought up. When we were talking about sort of gathering our time frame and sort of recalling our situations before coming on this podcast, I said, Ali, we have to be careful to not sound to like we're such big complainers, because there are so many people that have it worse out there. But we've been told, oh, you're my thinnest lymphedema patient, and almost like you should be happy with, I feel like the dismissiveness that you get is so hurtful. It's crushing. And the other thing that and I think Emily, possibly, this was a couple episodes ago, you had on a psychologist, and she was talking about how she likes to see patients right away when they're diagnosed and talk to them about having this chronic illness. And if I ever had access to someone when I was 14, 15, don't get me wrong, I feel blessed for who I am and all that I have. But that would have been a life changer. Just a life of feeling so damaged and alone. And even having Ali, just so horribly sad, so many parts of it, that I feel like in your super team for your future lymphedema patients, yes, the psychologist is definitely should be on the list.
It's very good.
Absolutely. And it's always so difficult. What I found really difficult, it's not totally proper only for lymphedema, but globally speaking, for all chronic diseases. And most of the diseases, believe me, you have no cure.
Yeah.
What cure do we have now for hypertension?
Mm-hmm.
Zero. You give the palliative treatment for the all patients. What cure do we have for diabetes? Almost zero, right? Exceptionally. So I think that's what you touched, that there is that obsession by the condition, that it's necessary for you to take care of you, but it's like have this bothersome aspect, So everybody has to find a good balance between this thinking and preventing the situation that makes your condition worse, but not feeling penalized or not being unhappy because of this. And that's a very difficult state to achieve.
And I'm going to say one other thing on top of that, which is fascinating. Now we're really talking psychology. Here you have a situation where you have two young women, especially when they were back 20 years old, dating, looking to get married, engaged, start a family and everything else, and devastated by this problem, which is a psychological, emotional issue in itself, psychosocial and emotional major problem in itself. Now, on top of it, I tell you as the physician or a friend or a family member, get over it. You're okay. It's not so bad. You shouldn't complain. You're beautiful. You're thin. You're slim. It's not, you're not going to die from it, right?
Yeah.
Now, on top of all those psychosocial and emotional issues you have from the primary disease itself, now you have a secondary problem of guilt and feeling, oh, they're right. Maybe I shouldn't feel this way. I'm so weak. I should be stronger, but I don't feel the way they tell me I should feel. I do feel upset about it. So it's almost like, the secondary lymphedema on top of the primary lymphedema. This is kind of like a secondary psycho-emotional wound on top of the primary psycho-emotional wound, that now you have to feel, on top of everything else, you have to feel guilty about the way you feel.
Right. It's true. Right. Absolutely.
Yeah.
Right. Yeah. And because what they're saying kind of makes sense. Like you look at yourself and you look at that other patient over there and you think, I do feel fortunate that I don't look that way. But at the same time, I really don't want to be this way either. So now you have that guilt. So it's really complicated, and it's a fascinating subject. And as you said, Stephanie, it would be a blessing if we could get, especially young people, the kind of counseling that they need, because these are, imagine you guys are now in your 50s and almost 60. you're still struggling with it every day. How's a 15-year-old supposed to cope with those feelings?
Yeah.
Absolutely. Absolutely.
Impossible.
Hiding. I mean,
Yeah, it's tough.
yeah.
Well, even, for example, one of the things that they always say is good to do is, do yoga, and this will help, right? And I love yoga. I used to go, and it was supposed to be relaxing, but all I could do when I was in a class is look at everyone else's feet and look at mine, and the whole class, I was like, I can't do this. I tried to wear like bigger pants on the bottom, not the skinny tights. And I had to stop going. Like, I do it at home now, which is fine. It works out great. But the point is, it's like even trying to help myself on a mental, a physical and a mental in a way like that was very challenging for me. Because you're barefoot in yoga, right? So everyone's feet are out. And I would just be looking around and fixating on, look at those nice skinny ankles this woman has, and look at this. And oh my God, mine are really swollen. So it goes back to how it infiltrates every single thing.
Yeah.
I'm sure even your family members too, the whole family system is affected by the disease.
Oh yeah. I mean, our husbands are gems. I mean, they've lived with this disease with us for 40 years. I don't know, but
our ups and downs. And
my kids too. I remember them being tiny and being like, "They don't look bad, Mom. Why are you crying? Nobody can see." Just. I don't know. It's sad.
Yeah, it is. It is sad. I'll tell you too. One of my daughters recently hurt her leg. She was she hurt it, and she had a stress fracture. And I remember going to the doctor with her, and she had a sock on, like an ankle sock. And I just remember looking at her ankle, and it looked swollen to me, and it almost looked like the way mine used to look. And I walked out of there, and I thought, oh my God, like, I hope I didn't pass this on to her. It was just horrible. It's so, and thankfully her foot, it's gotten better. It's healed. It was probably the process of, I'm sorry, but it gets to you when you start really thinking about
a lifetime of it.
Like our kids. Now I have 3 kids. I have 2 girls and 1 boy. And it's like, I'm just hoping they get past their 20s. They're getting there, and I'm hoping that everything's going to be fine. But it is a worry. I thought, oh my God, I was crying. I told her I would feel guilty for the rest of my life if I pass this on to you.
Yeah.
It's just, so I know, sorry, but
no, we understand fully. Don't be sorry.
I think to apologize for this is an amazing, sharing that you're doing, and it takes a lot of courage. And so many people, thousands and thousands of people, are going to benefit from this program today.
I think it's because you were also, we were so excited that you had the podcast, because we're fascinated by it. We listen to all of them. And yes, some of them get very medical and some, but just to hear you all talking about it, and your compassion about it, and your hope to find, help for people like us. It's just, we've never felt, it's like such a support group. So we thank you all for that too, because it's been tremendous for us.
And I think too, to Ali's point of imagining her daughter having to go through life with this too. My daughter, she has said jokingly a few times, "Oh, when I get lymphedema, I'm going to get really pretty color compression stockings." And I thought, at least now we have come to, even if it took us a long time to go down this road, we do have what I feel are some tools to deal with this. And, between what Dr. Chubak has been able to do for us and just all the information that is starting to finally be out there, because you are all pulling people together that are constantly talking about it. It is a godsend. It is just, unbelievable, really.
I told you all it was worth our effort, didn't I? They don't do it all the time. They say, let's not do it anymore. It's not true. It's fantastic. Well, listen, We could go on and on. We could have you for 10 episodes in a row. This has been just eye-opening, and it's just, we've touched on so many key elements of the process, physically, surgically, medically, psychologically, emotionally, nutritionally. And we're going to, with your help, having participated in today's program, we're going to touch the lives of thousands and thousands of people. And I hope you'll tell your friends about it, that you were on the show, and share it with people so they can share it with other people, because you never know who's going to know someone who might benefit from this information. So with that, I'm going to hand it back to our amazing host, Paul W. Reeves, Doctor of Education, phenomenal percussionist, musician extraordinaire, educator supreme, to take us out of today's show.
And keep going. You're not done, right?
Handsome, debonair.
I'm all for, I know it's logistically impossible, I'm all for starting a second show and having these two ladies as the guests on every single segment. What do you think, John?
I think it would be fantastic. I think
they could have their own show.
For sure. Honestly.
Well, we want to thank everybody for tuning in to our Lymphcast show, episode 39. Again, you can find us, lymphcastnetwork.com. If you have a question for the panel, send it in by email, hello@lymphcastnetwork.com. We're on every podcast platform under the sun, we believe. Just type in the show, you'll find it. And we're also on YouTube. Let's go around the room and thank our panel tonight. Dr. Chubak, if you don't mind, could you take a moment, give you the honor of thanking our two special guests tonight?
Yes, I want to thank Alisa and Stephanie one more time for being on the show. It has been, I think, clearly one of our best shows ever, which I think is saying a lot because we've had some great shows. But I think, to the credit of our executive producer and my dear wife, Diane Chubak, these programs that are more patient-focused, I think we need to do more of, and tell more stories and bring to light all of the aspects of this disease, because there's a lot more to swollen feet than just a swollen foot, obviously. Mm-hmm. And the more that we can educate and bring these stories into the light, and people have the courage to tell them, the more people that we're going to open, obviously help in the long run. And so I thank you both for your courage. I thank you both for your time and for sharing what has been such a personal journey for the two of you, with not only us on the panel, but really with the rest of the world and with the lymphedema community. So thank you.
Thanks to you all too, honestly.
Yeah, we feel completely
grateful.
Blessed, yes, to be a part of this wonderful panel.
Yeah.
Well, it is an unforgettable day for us.
Yeah,
really.
yeah.
All right. Yeah, thank you very much. From Arizona, Dr. Monica Glavitsky. Dr. Glavitsky, thank you for everything tonight.
Thank you very much, and thank you, Alisa and Stephanie. It is absolutely wonderful experience to meet you and to hear your story. I would really invite you, whenever you want to have more explanation of some medical words or medical condition, or if you have any idea for a subject for the future Lymphcast, please share it with us. It will be greatly appreciated. Okay?
Sure.
Okay.
All right. Very good. Out to California, Dr. Emily Eicher. Thank you for everything tonight as well.
Thank you. Wonderful ladies. And after Monica, I just have to say, I am inviting you to Santa Monica.
We'd love to come.
Yeah, we're coming.
To see how well you are going to improve. If you still have patent lymphatic system, you always will improve.
Oh,
it will be well worth the trip. The trip.
Dr. Chubak, I think they're trying to steal your patients. That's what's going on here.
There's no thievery here. We're in a sharing community.
That's right. Also from New York, RVT, Jacqueline Sasek. Jacqueline, thank you for everything.
Paul And thank you, Alisa and Stephanie, for your honesty. It was beautiful. It was really beautiful. And I'm going to invite you to Goshen, New York, just to hang out.
Okay.
Now we have the RVT stealing your patient, Dr. Trubak. You might as well come to Florida, too. Just make it a grand suite.
Jackie runs, I got to give a shameless plug for Jackie. Amazing retreats, psycho-emotional retreats at her amazing home in Goshen, and it is something that the lady should look at, and all of our listeners should look into. She touches a lot of lives with the work that she does also. She tends to be a little quiet on the show, but trust me, she's a powerhouse emotionally and intellectually. She's a great lady.
All right, very good. The creator and founder of this show, he also is the founder and owner of Vita Support MD. They make Vein Formula 1000 and Lymphatic Formula 1000 from New Jersey. Physician, surgeon, from whom they're trying to steal 2 patients, Dr. Trubak. Thank you, Dr. Trubak.
Keep going, Paul. Keep going.
handsome, debonair, man about town.
But I don't have a mustache.
You're an artist. You can you sing? We might as well throw that out there too.
I don't want to prove it or disprove it this evening.
Well, thank you, Dr. Trubak. Thank you for everything.
Thank you. It's a great show. Wonderful evening. Thank you so much.
Absolutely.
Thank you.
Again, that ends our show tonight. Lymphcast episode 39. We'll see you next time. Have a great night.